Well, welcome to our UC Davis Facebook Live, where UC Davis health experts provide information that you want to know. I'm Trisha Tomiyoshi, and I'm happy to be joined today virtually by the Associate Vice Chancellor of Health Equity, Diversity, and Inclusion, and Clinical Professor of Psychiatry and Behavioral Sciences, Dr. Hendry Ton. Today, we will be discussing our role in the community as an anchor institution and some ways that we're working on maintaining a caring environment. If you have questions today, feel free to leave them in the comments section and we will get to it towards the end of our Facebook Live. Dr. Ton, thank you so much for joining me today.
Thank you for having me, Trisha.
This has been an incredibly challenging time for all of us. How are you holding up?
Thanks for asking. It definitely has been challenging times with the dual pandemic of racism and COVID-19. But I would say these are also growing times as well. And for me personally, it's warranted some reflection, both on a professional level and on a personal level. And I feel like these practices help me to foster within myself a greater sense of meaning as a person, but also as a leader, it's helped me to identify a path towards action.
Wonderful. We know that so many people have been having a difficult time in stressful work environments, trying to maintain social distancing. How have you been providing guidance to our community on treating people with a little bit more patience and compassion during this time?
Well, over the course of the sheltering in place, we posted a number of webinars, 8 webinars actually, on coping as a community. And these webinars are meant to help to address wellness, coping, compassion, and racism, particularly as it relates to COVID-19. Now, moving forward, we've decided to change the name of the series to Growing as a Community to reflect a more active process to address racial inequities and healing as a community. But I also wanted to take a moment to speak about the notion of patience versus complacence. So there are situations that are outside of our control. And in these situations, it can be healthy to foster a sense of patience and to build our enduring resilience through these situations that we have limited control over. And during the COVID-19 pandemic, there are a number of things that we have limited control over. And so having a little bit of patience can go a long way in coping personally, as well as coping as a community. But I think that we have to be careful because patience can also slip into complacency when we allow bad situations that are within our control to continue on. This has to do with the pandemic or epidemic of racism. We can make choices to end racism. Each of us can, all of us can, especially those of us with more privilege. And so while changing these structural inequities won't happen overnight, we have to sort of be one with that feeling of urgency, with that feeling, if you will, of impatience, because there is an opportunity that we have as a community to actually move the effort forward every day. And it's important for us to be cognizant as well as we move forward that what we're feeling, the discomfort that we're feeling, the urgency and discomfort and unsettledness that we are feeling in society, it's actually a justified sense of urgency that's born out of 400 years of racial injustice and preventable deaths. These are our choices. And so it's important that we don't be patient about that we work every step of the way to make sure that these changes, which are within our control, happen.
Nice, nice. As a community at UC Davis Health, as well as our greater Sacramento community. That's beautiful. For the webinars you mentioned, are those open to the public, or how do those work?
Yes, they are open to the public. And so we advertise them both at our website, they're on YouTube as well. And we circulate them through the health system and to our community partners as well.
Nice, nice. UC Davis Health is an anchor institution. For those who may not be familiar with that term, what does that mean?
Yeah, so several months ago, UC Davis Health started the Anchor Institution Mission, or AIM, for Community Health Initiative. So anchor institutions are organizations that leverage their economic power to address issues like poverty, unemployment, and food security. If you think about the multi-million dollars that UC Davis and UC Davis Health has, that we move around, these resources that we move around through communities, through businesses, within our own institution, that's a lot of resources. So why is it important for us to be an economic engine to address poverty, unemployment, and food insecurity, amongst other things like racism as well? Well, the reason why is that according to the science, these factors, poverty, unemployment, difficulty with getting education, racism, sexism, these things are referred to as the social determinants of health. And by addressing these social and economic factors, we can actually triple the impact, the positive impact that we have on a person's health, rather than just providing access to quality healthcare alone. So we can magnify our impact as a health system if we not only embrace ourselves as an institution that provides the best quality patient care, to embracing an organization that is a partner with the community to address the social issues that contribute to lives lost and mortality and morbidity of our neighbors.
That's great.
And we can do this. Yeah, it's very much in line with our mission as healthcare institutions. So how we can do this? We can do it by adopting strategies such as increasing our procurement and contracts with local and minority-owned businesses so that the resources that we get, we can funnel into community businesses. We can work, and we are working with the CSU and the Los Rios community colleges to enhance local workforce pathways so that people who are getting out of high school can and go to the community colleges, they can find a pathway to jobs here at our health system, at the other education institution, other health systems in the area as well. And what we do there is we help community members create and keep wealth within the community. This is really important. Developing the local workforce is really important to address gentrification as well. So gentrification is where you have community wealth, but in conjunction with community wealth, you're also displacing the original community members. But if we are working to invest in our community neighbors, helping them to stay within the neighborhoods and to help neighborhoods to find greater economic prosperity, that will lead to neighborhood stability and better community health, which is really what we're about.
Fantastic. If you just joined us, we're discussing our role here at UC Davis Health as an anchor institution and ways to increase our compassion within our community. If you have questions, please feel free to leave them in the comments box and we will answer them towards the end of this discussion. So Dr. Ton, we know that this pandemic has disproportionately impacted communities of color. How has UC Davis Health been working to increase our communications and our outreach to those communities?
Well, I think that as I was hearing about the health disparities that were experienced by communities of color as it relates to COVID-19, one of the things that came up for me and my colleagues was, there have been outreach efforts into communities of color, but the relationships aren't trusted. And so it really drives home the importance that for us as a healthcare institution and public health in general across our country, that we have to work to earn the trust of our communities. And we have to acknowledge that the historical racism and injustices and even violence that we in the healthcare and public health sector have contributed to is part of the legacy that our community partners think about when we say, hey, we've got something that we want you to hear. We've got something that we want you to believe. And so we can't go in there with the assumption that we've earned that trust. We have to continually earn that trust. So what we have been doing on our health system level is we've partnered with faculty members and with clinicians such as Olivia Campa, Cara Tolles, Sergio Aguila Gaxiola, Carter Todd, my heroes, and working with our community partners to help to bring information that is trustworthy, that is understandable and relevant for the communities that we are trying to connect with, to help people to understand what COVID-19 means, what the risks means, and what the resources in the community that are available to help our neighbors. We've also, as a health system, worked with various partners such as Sac County and the Public Health Department to provide free COVID-19 screening with, again, in conjunction, in partnership with community organizations that have a long-standing history of work, of trust, of relationship with our diverse communities. So I think my drive home point in this is that we in health may have the academic and the scientific knowledge that we hold to be truths, but it is very important that we have an ongoing efforts to foster meaningful relationships, trusting relationships with our community and community partners, so that when it comes time for us to share what we believe to be important knowledge, that that we have the relationship to help us to convey both our goodwill and our credibility.
Beautiful.
So community partnerships are a long-term endeavor that we have to invest in.
Yeah. And it's been a relationship building that's been going on far before this pandemic. It's not something that's just begun, the last few months, right? So you're tapping relationships that have already been tapped and are formed.
Mm-hmm.
So how is the institution using its anchor institution mission to guide our outreach and showcase our efforts to increase diversity and health equity?
Well, the Anchor Institution mission has really helped us to re-envision our role and partnerships in community. That the idea of our relationship just being based on the patients that we see, even though that is super important, very critical, we have to really expand it to looking at our relationships with our community, with our neighbors, as also one of partnership as co-members of a neighborhood, of co-members of an economic and social context and situation. And so by embracing this aim for community health, we are looking at our relationship, not just from a patient care standpoint, but from a health equity standpoint. And by doing this, we're developing a better understanding that it is really important to expand and to leverage our community and public presence to improve awareness of racism, to improve awareness of violence, food insecurity, of poverty, to help people to understand that these are health issues. And it helps us to understand that when we are providing that information, when we're conveying that conviction, that it has to be done outside the walls of our institution and into community-defined spaces where our community members call home, where our community members feel most comfortable, even though we might not be most comfortable in those situations. These community-defined spaces are at community centers, at schools, even at homes, and even at peaceful marches and demonstrations as well.
Great. Are there other ways that we're addressing systemic racism as an institution?
Yeah, so there's a lot of work that has been going on, but a lot more work that is starting to emerge. And our office, the Office of Health Equity, Diversity, and Inclusion, has put on our website a living document that is an anti-racism, diversity, equity, and inclusion action plan. And we have 4 main points to our action plan. One is to recruit, develop, and empower diverse leadership. The second is to expand, to reinforce anti-racism and DEI, diversity, equity, and inclusion learning. And then there are things that we need to do to address structural racism and inequities within our institution, and things that we need to do in partnership with other community members and neighbors to address the systemic racism and other structural inequities in our community outside of our institution. That's the 4-point plan, and I would highly encourage you all to go to our website, take a look at that plan. It's a living document, meaning that the things that we're able to meet will update that. New things that we're discovering to be very important in our efforts and our collective efforts to address structural racism will include in that as well. If you have comments or feedback, you can also, there's a link on our website where you can provide that feedback and input as well.
All right, wonderful. We'll check it out. As you know, it was Pride Month in June. Can you tell us a little bit about our Pride employee resource group, and also how UC Davis Health supports the LGBTQIA+ community?
Absolutely. So yes, June was Pride Month, and it marks the anniversary of the Stonewall protests that happened in 1969. That really helped our society, American society, to really recognize the importance of LGBTQA+ civil rights. And you know, I and my colleagues just can't help but see the parallels between what went on in 1969 and the years subsequent, and what's been going on with both the pandemic of COVID-19 as well as the pandemic of racism. You know, our Pride employee resource group is chaired by Kate Turpin, who's at the School of Nursing. And this organization, this group, helps to lead efforts to support LGBTQIA+ people, both at UC Davis and in the community. And while COVID-19 prevented us from having a Pride March in June, it did not stop the Pride ERG from showing the best of who we are at UC Davis. So members delivered food to immune-compromised peers through the pandemic, and continues its important supportive and advocacy work, both locally within UC Davis and in the community. Some of the other things that we are doing as a health system to embrace and advocate for LGBTQ health equity are one of our professors, Swati Rao, is working with a group of people to develop a transgender health service. Transgender people are have very significant health inequities and challenges accessing health care in very significant ways. We are also working on sexual orientation and gender identity inclusion. We've been doing this for the past decade, and for the past 9 years, we've been named the LGBTQ healthcare equality leader, which is a national distinction. What it means is that we are on the right path, but there's a lot more that needs to be done, both at our institution and on a national level. And I will say that that's the case for a lot of our equity efforts, is that there's a lot of work that we've done. I think that we are on the right track. There are many things that we need to look at to really truly address structural inequities. But I have to say that I can't imagine being in another institution with another group of people that I enjoy and appreciate working with to really advance these really important efforts forward.
Excellent. Well, we've received some great questions from the public. I'll start with this one that's kind of related to what you were just talking about. How can current employees get involved with community work?
So so that actually is a great and important question. I would say the first step that you can do. So there are many options. There are organizations in the community that can help to organize volunteer efforts. And so we can post some information about those organizations. But it's important that to think about how your efforts can be coordinated so that there's a big impact. Some of the things that we are also doing, and I want to really acknowledge and congratulate our employee resource groups. So Pride is one of a number of employee resource groups, and those groups organize volunteer efforts as well. So I would encourage you to join one of the employee resource groups and work with the members of those groups to do volunteer work as well. We are also, as an office, looking at ways that we can leverage the collective human power of UC Davis and UC Davis Health. If you think about the tens of thousands of employees that we have here and the wealth of knowledge and skills that we can marshal on a volunteer basis to help uplift our communities, I think that there's some tremendous potential that we can tap. I used to work at a community-based organization. I was a medical director for 9 years. And some of the things that we really wish we had were things like advice on formal mentorship, training for our people to use office suites. These are things that many of our folks here have, and it's skills that our folks here have. And we're thinking about ways where we can help to gather the skills that we have here at the university and health system, and understand more about what the community defines as their needs, and look for ways for us to be helpful in addressing the needs that the community and community organizations have defined.
Wonderful, wonderful. And you can also check the Insider for those employee resource groups, how to get more information and their meeting times and so forth. A couple more questions we've received. Do you have any insights on how to speak to multiracial teens and teens in general about these times that we're all going through?
Mm-hmm. Well, I think that the first important step is we need to do our homework. We need to understand the social context. We need to also understand the historical context. This is, I think, really important that our history, what we know about history, makes us have certain assumptions about the way the world is. And the history books don't tell the full story. And it certainly hasn't told the full story that my Black colleagues and patients have shared with me. And yet, if we don't understand the history, the historical context, we continue in conversations making these assumptions that are, quite fatiguing for our colleagues to try to explain. So the first step, let's do our homework. Let's do some reading. Let's look at the books. Let's deconstruct a bit of the history that we've learned to include the history and the context that aren't well represented. So that's, I think, the first step. The second step is, to check in with our multiracial and diverse teens as well. Having those relationships, cultivating those relationships, I think are really important, and having a space to have these conversations, I think, are really important. It may be that our teens are not ready to speak, and I think that that's okay. They can, they can let us know to speak in their own time. But it's so important for our teens to know that we are here and that we are available. I think it's doubly challenging for our teens because as a teen, you really grow in your peer groups, your social groups, and because of sheltering in place, that has been a real challenge. And so, if you have curfews around social media, consider relaxing those curfews during the time of sheltering in place, because these are some of the ways in which our teens are connecting with their peers, which again is an important source of support. So check your history, create space for the conversations. For some of our teens, it's also about like dropping hints and clues as to where we stand, that we are in support. Some teens, especially our LGBTQA teens that are not out with their families, may be in particular distress because of the isolation. And so making sure that they have access to peer groups online can be a really important source of support.
Perfect. Lastly, could you share with us one of the most challenging parts of your work as an anchor institution?
Well, I think being an anchor institution is a long-term investment. So it also means looking at every aspect of our operation. So it used to be that when we think about health equity, we think about like patient care. However, when we think about health equity to address the social determinants and being an anchor institution, we need to look at how we do business. We need to look at our policies for who qualifies as a vendor. We need to look at the lists of vendors that we have. Are they local? Are they from the communities that we hope to support? And so I would say that's a new perspective. It's been exciting though, because I think that there are a lot of people who have come to UC Davis because we have roots in the community, and who are part of our finance office, part of our the people behind the scenes that support our patient care enterprise. And I think that many people have yearned to be part of the institution in very salient ways to make a difference. And I'm also seeing that as well, that people are coming out saying, yes, this has been a way that we understood we can help, but now we understand that there is actually a direct impact on community health. I think the other challenge, quite frankly, is that we have work to do with our community partners to cultivate and deepen our level of trust. And so what that means is engaging in conversations that are uncomfortable. As a member of UC Davis, I need to hear and I need to be very open to what the community says, both the positive things about what we're doing, but also the things that we need to improve upon, things that were part of the leadership team that I was a part of, but also things about the work that we've done that predates me, acknowledging that historical context, acknowledging that whether or not we had a role in playing it as in those historical issues as individuals, we have a role in learning about that history and moving forward in a positive and impactful way in the future.
Perfect. Thank you, Dr. Hendry Ton, for spending the time with us and sharing all this great information. And thank you to our audience for joining us for this UC Davis Health Facebook Live. If you have any additional questions that you'd like to ask, please feel free to include them in the comments, and our UC Davis Health experts will return a response. We encourage you to share this post if you have family and friends who would be interested in learning more. And for more up-to-date information about COVID-19, please head to health.ucdavis.edu/coronavirus. Thank you so much for joining us. Have a great rest of your afternoon.